Okay, so Medicaid expansion in Tennessee. Adults 19 to 64 with incomes less than 138% of federal poverty guidelines. And that's federal. Your numbers over here, the 11,490 is
100% poverty.
Right, and this is for a family of 4. They would have qualified for the expanded Medicaid program. But since Tennessee is so far chosen not to participate, and if you look at a map or you read an article, like which states are, which states aren't, Tennessee's still in the undecided column. The governor said that they would decide by the end of the summer. Then when nobody was going to the pool anymore, they said, have you decided? And he said, well, the end of the summer isn't till, September something. Well, that date has come and gone. So, yikes, it's the end of the summer and he still hasn't decided. He also hasn't put his official Tennessee plan in writing and sent it to HHS. So, in a sense, we're being just kind of strung along. And in a sense, hopefully things will happen after the first of the year when the legislature comes back, and we're all going to kind of brainstorm about this a little bit after a while, that hopefully will push things in the right direction. But the fact is this state's going to lose $2.8 million per day that should be coming here for expanded Medicaid coverage for people who need insurance, for the hospitals, rural and otherwise, and the providers, and our economy is just going to suffer. Not only is it life and death for the people who aren't going to have insurance that should on January 1st through Medicaid, our economy is going to be life and death for our economy as well. It's a huge loss of money.
Health insurance and social services is the highest employment sector in the state of Tennessee. It is above our tourism for the employment sector, and that is going to be greatly harmed by this. To clarify that 138%, if you read the law, it says 133% with a 5% disregard. So if you see 133 and think you're wrong, no, it's 133 plus 5 disregard. So that's how that 138 gets up there.
And the other place that I was going to mention is why is this 138%? A couple of slides ago, we talked about people qualifying for marketplace and premium tax credits between 100% and 400%. That 100% threshold is where we drop down because we don't have Medicaid expansion. So if we all of a sudden got Medicaid expansion, the Tennessee plan for Medicaid expansion, then people under 138, the 133 with the disregard, would go into the Medicaid program, and the marketplace would kind of, its bottom threshold would come up. So the marketplace even has a little bit of a function to try to push that down some and get a few more people into the marketplace. But it can't go all the way down because the subsidies just don't work at that level. It has to be managed through Medicaid. What we have with Medicaid right now, how many people here in this room have been on Medicaid, know how Medicaid works right now in Tennessee? TennCare. All right, me neither. Tammy does. So, Tammy, how do people get insurance through TennCare? Who qualifies?
Well, back when I had it, as long as you had an insurance company say that they would not cover you, send that in, you could be covered. That was back then, that's not now.
Right.
And income level, single kids.
Right. Yeah.
Pre-existing, yeah.
And I know Mary could probably tell us so much about this because she's been doing this for so long. And I'm going to tell you kind of my shorthand version because I just learned about it. And a lot of us are just learning about it. A lot of people we talk to on the street are just learning about it. And tell me if I'm saying anything wrong. Okay. But Medicaid is designed to give health insurance to poor people so that they have health care coverage. But there's only so much money to go around. And so it's income-based. Under a certain income, you should be able to get health insurance. Okay, you should be able to get health care. But there's only so much money to go around. So then they prioritize categories of people. So a child, a pregnant woman, a person with dependent children. So if you're not in some of those high priority categories, then even though you qualify, you can't get it. You don't fit in. So young men, older men, single women, women without children and dependents, a whole bunch of people should qualify. They qualify based on their income, but they don't fit in because of the categories and the priorities. So why do we need to expand Medicaid? So that we don't have to rely on those categories to push people out. Okay? My brother-in-law was one of those people. He never could get on Medicaid. He never could get on it, and he eventually died of whatever he died of. He didn't want to tell us about it. He didn't want to talk to us about it. And he would be in the hospital and get stabilized and then back out. So what was that doing to our healthcare delivery system was, first of all, he probably could have lived through whatever he had if he could have gotten the right kind of care and services, or at least he would have been able to talk to his family about it and not been ashamed of it, and we'd know what had happened to him. I have a son. I'd like to know if he died of something hereditary so that I can tell my son what it was, right? So the other thing it did was it cost a tremendous amount of money and uncompensated care at each hospital that he went to, at each doctor who tried to help him. And he was a Vanderbilt emergency room nurse and a life flight nurse. And so he got excellent care. Every hospital that he went to, when he would finally get sick enough to go in, they would find out who he was, and they would just treat him like gold standard, platinum standard, okay? But then he'd be back out, and he'd get sick again, and then he'd be back in. So that's what happens to people when they're categorized out of Medicaid, okay? The thing that the Medicaid expansion would do for us is it would give us enough money in this state that we didn't have to categorize people out anymore. If you qualify, you qualify. And that's how it's meant to work. The other thing is that how does Medicaid get paid for? Right now, the federal government pays 2/3 and the state pays 1/3. It's a lot of money. It really is a lot of money, even though we have a pretty full rainy day fund right now. But it's a lot of money, okay. So when this law went in front of the Supreme Court, this is the one part of it that got changed, that because the states pay into the Medicaid, and each state gets to run its own program, they can choose whether they're going to do this or not. And it's unbelievable the number of states that opted out of it. We have the opportunity to have 100% instead of 2/3 paid for by the federal government. Okay, so we would expand Medicaid by maybe 300,000 or so people is the estimate I've heard of 400,000. Folks in Tennessee who could then get health insurance, get preventative care, get in the hospital, get their lives saved if they need it. But we're not going to do it because at the end of those 3 years, can't you do multiplication? Don't you know how much more it's going to cost us when that 100% is over? Well, do you see what I'm saying? That's the argument. Have you heard that argument? Yeah. The federal government's going to pay 90% after 3 years.
No,
we're only going to pay 10%.
After 6 years.
After 6 years.
95, 93,
Oh, 95. Well, see, that's even better. So, but it's a concern. It's a worry. Once you start giving people something, how will you ever get it back from them? How will they ever take care of themselves, right? How it's bad for them. Helping people hurts people. So the idea is that, and there's an economic argument that we need to talk about. We know that we care about people's lives, and we know that everybody else cares about the people that they care about in their lives, okay? But like if it's someone who says helping people hurts people, they will help their children. They will help their church folks. They will help their neighbors because that's how people operate. But we also need to make an economic argument, and that is that $2.8 million per day is going to keep our rural hospitals open. It's going to echo through our entire economy, and in a state like Tennessee, where we earn our revenue, our state revenue, through sales tax, every penny that we're not bringing into our economy is costing us money, costing us a huge amount of money. We've got to have that money circulating through, and to say no to that level of money. Guess who agrees with us? Tennessee Business Roundtable, Tennessee Medical Association, a huge number of lawyers, lobbyists, and business people agree with us big liberals in this room that this is what we need to do. So eventually we're going to be able to team up, and we're going to be able to find ways to push our state in the right direction. We talked about what we're buying when we buy. We've got the 10 essential cores. We talked about how we buy it on the marketplace, what the premium tax credits are. Now we talk about when we buy it. Okay, Medicare is for people over 65. Medicaid, yes, Medicaid is the federal name for the program that helps people in poverty to get health insurance. TennCare is what Tennessee has named its implementation of its Medicaid program. So that's, and there's some other programs. There's Cover TN, there's other stuff.
Here is our Medicaid program, and the author of that was Nancy Ann Minda Pearl out of Harriman, Tennessee. And she went on to become the chief health advisor for this plan for President Obama. And the political person that got this done was Wendell Potter, born in Mountain City of East Tennessee, who went on as the whistleblower and got this finally passed for health insurance reform. So this should not be called Obamacare. This should be called East Tennessee Care.
And that's what I mean when I say there's a huge amount of talent and brilliant, dedicated people in Tennessee. It's really true. And what we need is the political will to pull those people back in. I think we've almost, this is very far aside, we've almost deconstructed the Democratic Party enough that we're going to reconstruct the right way that we need to be. So, right? So we're almost there. We'll see what happens next week. So, where to apply? And this was on that little video. There's 4 ways to apply. Healthcare.gov is a great way. Phone, you can call that phone number and somebody's supposed to answer it and talk to you. Have you ever called a 1-800 number before? I kind of am not. I'm really scared to like tell people about the 1-800 number because I'm really.
Wait time is 25 minutes.
Yeah, you know, it just gives you such a. But you know, hopefully the people on the other end aren't in India. Not that there's anything wrong with being from India, and hopefully they're not incarcerated folks.
It's not the Hewlett Packard helpline.
Okay, good.
They're back.
24/7. And then SHOP, the SHOP program is for what? Small businesses. Yep, that's all you need to know. SHOP programs for small businesses. Here's a flyer. And then in-person assisters. That's your navigators, your CACs, your certified application consultants, counselors. And localhelp.healthcare.gov. I just typed that in there today. I'm going to show you what's there. What's your zip code? Who's got a zip code?
3734.
I shouldn't have asked it that way. 804. Find help. Let's see if anything comes up. 0 results. R. 0 results. 37716. Fingers are crossed.
Try 37725. You should find something.
Are you getting frustrated? Who else is getting frustrated?
I know why 37807 is populated. You
Right.
should be able to get it on
So
there.
what are you going to do? What are you going to do, though, when you're out there talking to people and something frustrating happens?
I'll get back with you.
You're all going to get frustrated together? No, you're going to have a clipboard that's going to say, I need more information. You're going to get more information, and then you're going to follow up with them. And believe me, following up is the hardest thing in the world. How many of you have ever called me and I didn't call you back right away? I'm really sorry. But following up is really hard, and we have to learn how to do that better. I do. Okay, so tell me that zip code that's got something in it.
37807.
807. And the website says, please check back also. Often it says,
But push your find help button.
yeah. I was looking for that text where it said, please check back regularly as additional organizations will be added over the upcoming weeks.
I've added 2 organizations in the zip
Okay,
code,
2.
and they didn't show
So,
up.
Clearfield?
Yeah.
And let me tell you that those 2 are kind of in the back door of Jellicoe Community Hospital, one of the hospitals at risk by loss of the dish payments. And they are one of the few that has their ducks in a row, and they're one of the poorest areas, one of the poorest counties in Jellicoe, and they are getting their ducks in a row and do it. And I'm kind of looking around at these big dollar hospitals in their areas and thinking, get your act together.
Right.
Yeah, Houston.
So this is one way. This is one way to get folks more information if you're in a situation with them where they need more information. All right. Yes.
Why doesn't this give you like a mile range? So there's no help in 37774.
I know.
We don't even have a driver's license office.
I-
So why doesn't it give you like a range of 15 miles or 20 miles?
I was on a CMS conference call this week, and they gave us an email address to send things to, and I sent in not a question but a suggestion box. I'm like, can you please plot this on a map, and please, give us a range, and it would be so helpful for those of us working in a state like Tennessee. So.